short case, you remember that each short case is 10 minutes and there are 4 short cases in the exam. 4. Okay? And they are, you know, one short case, go immediately to the other and immediately to the other and to the other. Okay? And in the short case, you are given a direction. Either look in the anterior segment of the right eye, or left eye, or both eyes, or the posterior segment, or look at do the muscle balance. You know, they will ask you if there is squint, or do the external examination where there is proptosis or whatever things. So there will be specific direction to you in the short case. And short case is 10 minutes. In those 10 minutes, time is very important. Short case, you have to see the bigger things, not the minor things, and you have got 3 to 4 minutes for examination. 3 to 4 minutes. Don't take longer, because if you take a longer, there are some candidates, they keep on seeing their patient even for 5 minutes. We tell them that now your time is finished, because we have to do the viva for remaining 6 minutes. So you will have, you know, the examination time between 3 to 4 minutes. That's it. So you have to, whenever the time, the direction is given to you, examine the anterior segment or a posterior segment, then go to that. And if they are asking you to examine the posterior segment, one of the tip is just quickly look at the anterior segment before putting the 90D on. When you put the slit lamp on, just quickly see if there is something wrong, or just quick. Don't spend a lot of time on that before putting the 90D. Just quickly देख लो कि उधर लेंस पे क्या है, आइरिस पे कुछ तो नहीं है, कॉर्निया वॉर्निया है, जैसे quickly देख लेते हैं. Just a quick